Okay, thank you very much. I'd like to introduce Jason Vale-Cruz of Tellus here in Phoenix, and Jason's very active with our initiative here in the state to address tobacco issues among LGBTQ and GSM populations. Jay?
So welcome back from break. I hope everyone got some time to rejuvenate and refresh after a wonderful lunch and a great morning of hearing awesome speakers. I myself, as Wayne mentioned, I'm Jason Vale-Cruz. I work for Tellus Health and the LGBTQ Consortium, which is a local coalition to empower LGBTQ health and wellness here in Maricopa County. I'm super excited about the next speaker because you can't mention LGBTQ health and wellness, and you can't mention work around tobacco in terms of LGBTQ issues without talking about this person. He's been recognized by the House of Representatives, state governments, city governments, and different organizations around the country. He also, though, and I can attest personally, has always taken the time out to meet with different local health organizations, different community coalitions, and other folks that are interested in social justice and LGBTQ health and wellness. And so I really encourage you to get to know and be excited by our next speaker, Dr. Scout.
Thank you. You're so sweet. All right, you guys, this is great. I am very excited to be here. I've actually been working with Arizona and Wayne and everybody for actually on and off for many, many years now. And you're one of the states that has continued to show interest in SGM health for many years. So that is great because it already puts you in the top, 25% of all the states around the country. So let me just jump forward here, and you heard a little bit about me. Wow, I'm stretched out there, aren't I? I'm actually doing a new social justice initiative now, too, so it's kind of interesting. I'm taking a lot of lessons that I've learned around the country for many, many years and trying to figure out how we can do a better job of telling our stories. So that's one of my great passions now that I'm working a lot on when I'm not, climbing and hiking, things like that. I'm actually hoping later this evening to go on a hike on your little mountains out here. Okay, so I just want you to raise your hands for me if you can. I'd like to get a sense of who we've got in the room. So how many people are direct service providers? What was that? How many are direct service providers? How many people are working as cessation counselors? How many people are mental health? How many people are policy? I'm missing a lot of the room. Okay, there's more. Okay, good. I was going to say, what else do we have? One person's retired, although apparently he's still causing a ruckus. We saw that this morning. Who else do we have? Public health. Health educators? Oh, that's a big block. Okay, great. Anyone that might be missing here? Academics. Business. How many are business people? Well, we all do a little bit of business, right? Insurance, you said? Insurance providers or insurance folks? The same three people? Anybody else I'm missing? Okay, kind of gives me a good sense of the room. And then if you can do me a favor, let's say, have you had LGBT or SGM training before? Raise your hand. Okay, great. Now I want to ask another question. How many people feel very, very comfortable with the issue of SGM health? Excellent. Okay, great. That's good. Room for improvement, and yet some great folks and some people who can clearly stop me if I go totally, crazy and correct me. Any particular things you want to hear about during this talk over the next few minutes? Don't be shy. This is your time. Why are the smoking rates so high? No clue, no clue. No, actually, I will say. Okay, good. Thank you. Anything else? Wow, you really are shy. We can just wait. Back of the room. Sorry about that. The big waves. Excellent. Yes, there are. NHIS. No, actually, I don't like NHIS, as a matter of fact. But NATS, I like a whole lot. Anything else? Yes. Okay, good. Last thing anybody might want to know? All right, I'm going to cover 3. Excellent. And then that'll be it. We'll get out early. No. Okay, I'll cover a few things too. Okay, so let's go over a little bit of the roadmap of what we got here. Actually, one of the things that people bring up a lot is that the terminology related to the communities is confusing. So I want to make sure that I give you some guidelines for how to effectively operate in this space where, frankly, the terminology is changing quickly. So I want to make sure you feel comfortable there. We're going to give you some of the facts, and I will also cover then where to get more of the facts and what kind of data sources you really should be paying attention to. And then we're going to do 2 levels of cessation. Because I'll give you the hint right now, one of the biggest things that we're dealing with in the SGM population is not that we quit smoking differently. We're humans just like everybody else. But it's that we're going to be really wary of your services, and we will not trust your services. So I'm going to give you 2 different types of levels of information on how to do a better job of having us be less wary. First of all, how to do a better job of reaching out to the sexual and gender minority population, and then how to do a better job of serving them once you've reached them. Yes, I love that. I'm sorry. Also, ask questions as much as you want. Actually, it's only SGM I've ever heard, not GSM, as a matter of fact. So you might be pioneering GSM right here at this table. Which just shows you, in a way, how the technology is the terminology, is kind of new. SGM has been used a lot, actually, by the federal government. And one of the great things for that is because the acronym had gotten so long that instead of adding more letters every time we came to another understanding that there was another underserved population, and we were like going on to our second line of letters, it just seemed a little easier to say sexual minorities and gender minorities became sexual and gender minorities. It also obviously, while we overlap with all the racial and ethnic minority populations and have huge, robust representation from all of the different racial and ethnic minority populations, and we do not share exactly common phenomena because you can't usually tell by the color of our skin necessarily whether or not we're a sexual gender minority. It does kind of show, though, that we do share common phenomena related to social exclusion and stigma. So it also kind of helps align it that way. But great, first question, I love that. Okay, so let's just dive into terminology right away. First thing is the big rule related to terminology. Like I said, this is new information. The terminology that the words that most of us are using on a daily basis are hundreds and hundreds of years old. And yet the word transgender alone, as an example, is actually only about 25 years old. That's it. So new language breathes. It kind of expands and contracts. It changes. Its meaning swirls around a little bit before it completely settles down. So a lot of these terms that we are now using in the SGM communities are terms that are so new that they're kind of changing, which is why the biggest rule that I would say for anybody who's not in the communities is focus on using the safe terminology, LGBT and LGBTQ, and actually I'll put up there SGM as well. That's just as safe, very safe. I didn't mean to leave it off. It's just that some places don't even know what SGM is. This is one of the conferences where it was introduced that way. So those 2 things are very safe. 3 things with SGM as well. Second rule, if someone comes to you in a service provision situation or a health education situation and uses something that you are not comfortable with, I really would encourage you to just ask to confirm that that's what they want. Like, wait, Wayne, you actually describe yourself as queer, right? That's what you'd prefer I use? As simple as that. And of course he said, right, there we go. So it's just as simple. No one laughed even? All right, fine. So it's just as simple as that. And I used queer specifically because that's the one that most people ask about because you're afraid of using it if you're out community because it has been used in a pejorative fashion. But let's just be clear. It is not like the N-word with the African American communities. It is much safer. Queer has been used and put on a lot of our national organizations' official names now. Like, for example, the biggest media outlet in the SGM communities is Huffington Post, and they just renamed their Gay Voices page to be Queer Voices about a year ago. So that's a sign of how accepted it is in the communities. Of course, it's slightly different with generational approach. Older people are not as likely to self-identify as queer, So you wouldn't want to be the one to start using it, but if someone's using it, you got to just ask them to confirm and then use the same thing back. Does that make sense? Because if you change it, like if Wayne starts to use queer with me and I say gay or something like that back to him, you don't know, but I'm changing what I'm now talking about to him in ways that you won't be able to understand. So that's why it's important just to echo that language back. And then if you're at the point where you're creating public materials, I then encourage you to get a few different community representatives to give you input, and not just one, because we've seen it a lot, where if you're a single community representative, they may still be using language that's kind of changed, and so a couple can usually be the safest for you. That way you know you're using things in a correct way. Good? These are your takeaways, all right? Now we're going to go into the details. Any of these words you don't understand? Lori, I know that. From 5 on down? Let's see, hold on a second. 1, 2, 3, 4, 5. You got all those? Really? 5 plus even? Okay, yeah. Oh, I'm sorry, you're right. You've got like 0-point type from back there? Oh yeah, okay, great. Gay, lesbian, bisexual, bi plus, polyamorous, and then we go to the ones that Lori doesn't understand from there. Ace, soji, aromantic, pansexual, go over there, trans, transsexual, DSD or intersex, queer, gender fluid, demisexual, and SGM. SGM you've got, right? There we go. And sexual orientation and gender identity, just to review the obvious, sexual orientation is who you choose to partner with. So if you are the same sex choosing to partner with the same sex, then that means you're usually gay or lesbian. If you partner with either the same or opposite, then it'd be bisexual. And that's, everybody has a sexual orientation, of course, right? And then a gender identity, everybody also has a gender identity. So like most of you identify as the birth that is on your birth certificate, the sex that's on your birth certificate, correct? Right? I don't. I was assigned female at birth, and that didn't fit me wonderfully. So I'm transgender, and my gender identity, the way I label it, is as transgender. Does anybody know what the opposite of transgender is? Good, cisgender. Yeah, cisgender. So if you identify the same thing as on your birth certificate, cisgender is the way you'd usually say it, okay? So let me go into a few of these then. ACE. Actually, it's a big thing with the younger folks these days. Did anybody have any idea what ACE is? Yeah. Oh, you stop. Stop. Yeah, that's cheating. I understand that. Does anybody else have any idea what ACE is? How many people you slept with? Well, in kind of a weird, convoluted way. It means you don't want to sleep with anybody. It identifies asexual. It's short for asexual. And it's really a big deal with the younger population now. So it's kind of something you'll definitely be running across. SOGI is just these words put together in acronyms, SOGI, right? I know. Aha, right? So if asexual is you don't want to have sex with anybody or you don't consider yourself like a sexual being, what is aromantic? It means you don't consider yourself to be romantic, the opposite of romantic. And that's another identity on the asexual scale, again, getting a lot of traction, especially with the younger population. What about pansexual? Pansexual is actually a subdivision of bisexual. And sometimes bi plus has been put out there as a way to kind of say that there's an umbrella of bisexual identities. One of them is pansexual, which means that you are attracted to people whose genders run the spectrum. It doesn't matter, male, female, or transgender included. It's fine, any of those things. And then, of course, trans is just a short for transgender. Does anybody know the difference between transsexual and transgender? Anybody willing to offer just throw out a possibility there? Okay, that was right. You were right on the nose. All of you were great with that one. So usually transsexual, if we consider that gender is like a football field and you've got female under one goalpost, male under another, usually transsexual means that if you were assigned male at birth, that you like the goalposts, the binary of just two choices fits for you, you just happen to be on the exact opposite one. So you would identify as female, period, the end. Likewise, if you were assigned female at birth, usually it means you just identify as male, period, the end. Now, here's another question. Does you identify as transsexual before or after you've had surgery? Before is one. Oh, you guys are so quiet. Come on. Anybody else? Either. Good. You're all right on the money. Absolutely. Does anybody have any idea how much the surgeries cost? A lot. Exactly. Everybody's getting all these questions right. The surgeries can easily run $50,000 if you're assigned male at birth and you're really a woman. And I don't know if you've got $50,000 in the bank. I don't right now, I'll be honest. And of course, we would hate to ever disrespect someone's identity just because they didn't have enough cash or they didn't want to interact with the medical system to get it respected, right? So we absolutely identify people as whatever they present. And I will be honest that to even inquire about surgeries is something that probably could be a real danger zone for you. Because the truth is, it doesn't have anything to do, it's not relevant to your interaction with them, and it's something that happens to us a lot. And I don't know if you are, like, we are a group of people where people are inordinately interested in our genitals. So trust me, don't go there, okay? It doesn't have anything to do with smoking. Actually, the one thing that actually does have to do with smoking related to it is if you're about to have any kind of surgery whatsoever, which includes surgery that might have whatever, but any kind of surgery, we know that smoking is so bad for the circulatory system that there are doctors, and I like these doctors, that require you to quit before you have any surgeries. So it is one thing you can say with a trans person. It's like, are you considering any surgeries? And again, what kind of surgery doesn't matter to you. If any surgeries whatsoever, then quitting smoking will help with the healing process. What else do we have here? DSD or intersex. They both mean the same thing. One stands for disorders of sexual development. And intersex is the newer word for what used to be a hermaphrodite. The myth is, though, that hermaphrodites have both sexual organs. Not the case, although, again, it doesn't matter what genitalia is going on related to us. It usually just means that, like, we all apparently start as female zygotes, and then through chromosomes or hormones, some of us move to male, some of us stay female. But as you can imagine in biodiversity, it doesn't always end up perfectly at those endpoints. So intersex folks are going to be somewhere in the middle, maybe an extra chromosome, maybe their hormones are different, something like that. Yeah. It's one of the phrases that can be applied to intersex people. Yes, absolutely. The intersex population sometimes overlaps with the LGBT or SGM population. Sometimes they like to be distinguished as different because the type of discrimination that they experience happens in a different format. They usually get some of their worst discrimination literally as infants. We don't get it as infants as much. So the phenomenon of discrimination is a little bit different. But there's still a lot of overlapping because it usually is related to gender stigma. Let's see. Queer we already talked about a little bit. Feel free to use it. And queer is usually something that can encompass any one of those identities. It's a short and fast way to say anything in there. And the truth is, since our identity doesn't always match our exact, like if you're a lesbian, that says you're a woman who sleeps with women, but our actual practices don't always match perfectly, right? For a lot of us. So sometimes it's just a lot easier to be like, oh, that's okay, I'm queer. Anywhere in there, right? Gender fluid. Ideas on that one? No. That just means that if you're on that football field of what your gender identity is, that you keep moving around the field inside. You're like, I don't know, today I'm presenting as a guy. Tomorrow I'm going to present as a woman. Maybe I feel somewhere right in the middle. But it's not something fixed for you. It swings. And then demisexual. I don't know why I put that on there. It's not quite as used these days, but it's another one on the asexual spectrum, and it actually means that it's people who will only have a relationship with someone who they've been good friends with first. You do not get attracted to strangers. And then SGM. We already know that one. Good? Everybody comfortable? Okay, excellent. Is there, yes, a hand, sorry. Please. We're going to have that whole session right after this. No, I actually think that we show some experiments of like people who are resisting putting out with the genders of their baby after their baby is born. And for some reason, our need to put that in a binary is so deep-seated that like their friends get angry at them. Likewise, in the same way, trans women especially get so much hostility on the streets when people realize that they're transgender. We don't know what's causing that reflex of that level. But like I've known trans women where they cannot walk down the street because strangers will start to yell at them and run at them from across the street. What kind of a weird phenomena are we in that someone's so upset by your existence that they'll start screaming at you across the street? And in the same way, the biggest day we have honoring trans people around the country is actually, does anybody know what it is? Trans Day of Remembrance, exactly. November 11th, I think it is. And every year we memorialize the people who've been killed that year for being trans. And let me just be clear, it's almost all women, and it's almost all women of color. So this, for some reason, taps into some kind of a weird, deep-seated thing that upsets us. So until we get past that, I'm not exactly seeing. It's a great thing, though. We can all help work for it. Okay. That you forgot. That was just the easy one for the terminology. Now we get on to the bigger one. Okay, this is just the yes or no on kind of what to use on a daily basis. And Lori, can you just remind me again, I go till 1:20, right? Okay, I'm still here. You can, whenever you get it. 2:20, yeah, that's what I meant. Sorry. Yeah, perfect. Okay, great. We're actually doing really well here. Okay, so the things you can use. You can use queer. Okay, what about this one? You guys got that one? Ah, come on. Don't even. Come on, you got it. Ready? L, lesbian, gay, bisexual, transgender, queer, questioning, intersex. No, these are together, actually. So good, but wrong. Think of American Indians. Two-spirit, yes, exactly. Great job. Two-spirit, does it mean transgender? No. It's usually used by the American Indian population, and it can mean anybody in the LGBT umbrella, okay? So there's a little bit of mistake sometimes that it's specifically trans people. All right, we're so close. Ready? Asexual, yes, and? Oh, that would be good, but not usually. Ally, look at that. Look at that. It's just, you're going to read it like a map now. It's perfect. I'm so proud of you. So then the other ones that are great, LGBT, LGBTQ, transgender. Wow, I still didn't put SGM on here, but again, SGM is great, so I don't know what my problem is. Cis means cisgender. That's short for the opposite of transgender. Yeah. Then trans is shortened oftentimes, sometimes with an asterisk, but I feel like that's going away. Don't you think the asterisk is gone? Gone. That's it. It says out. So trans without anything after it is often even used more than transgender these days. Okay, so here's a weird one. Doesn't this look a lot like that? Why do you think this is over here and that's over there? Yeah, space is important. What's the difference with that then when you have the space? Well, yeah, exactly. One is like a characteristic, an adjective. It's a type of person. The other one says it's a different being, right? So when you have the space, you're saying that man is a redhead, is tall, is short, is trans, right? When you don't have the space, you're saying, oh, that's a different breed of being altogether. So again, this is only for written materials, which is why you should get community members to review written materials. Luckily, when you say it, no one can see the space. But that's actually one that can really upset people. So written materials get people to review it. Transgender person, the reason I put that up there is because you don't want to say this one. Transgenders. No, again, that's like a different being, right? You instead want to say it's a type of person. It's an adjective. It's a redheaded person. It's a tall person. It's a short person. It's a trans person. You also don't want to say transgendered. It's not like we've been sunburned. We weren't fine, and then we got transgendered, and now we're trans. So You're getting the sense, right? Yeah, exactly. FTM, anybody get that one? Female to male, excellent job. MTF, male to female. And which one of those, so the easy thing, because they're confusing when you look at them fast, is you always want to just look at the end. These are the people who present as male now. So I am FTM. These are the people who present as female now. I am not MTF. And then I just actually always prefer, it's a little bit, not always used, but I always prefer to use communities in the plural, because the truth is we're so many different communities that we don't always overlap. So instead of single community, I would say plural. Okay, over here, please, for the love of God, do not walk away from this presentation and ever use this word right here, right? Please. Anybody have any ideas why? It's cute. What was that? I use the word tranny. It comes from the sex work industry. It's for guys who fetishize trans women, tranny and she-male, who's not up there too, please don't use she-male either, come directly from the sex work industry. And so people are very sensitive. They're like, I don't want you to call me the name that prostitutes are usually called by Johns. Makes sense? And if you ever want to get your head to explode as fast as possible, feel free to just use that in the LGBT forum and you will feel the wrath. So please don't do that, okay? Obviously put the space in. Transgenderism sounds nice, but in practice has only been used by conservatives to spout anti-LGBT stuff. So avoid that one too. This is funny because I was actually just doing this in Maryland, State Tobacco Conference, and I went out and they had their cancer plan out there. So of course I'm like, oh, well, let me look and see if queers are in their cancer plan. And sure enough, they were, but they made this mistake. They said the opposite of LGBT was straight, and it isn't, because the only opposite of LGB is straight. When you add T, the opposite is cis. So if you just want your language to be something that we read and know that you understand us, you got to put straight and cis, or you just say non-LGBT. The LGBT and the non-LGBT population. Fastest way to do that. And then, what is the largest LGBT group? Q. No, actually. No. A. No, but I like the effort. Keep going. You can't have that many letters left. Well, actually, we could if we go to the second one, right? Come on. What was it? G. No. Nowhere close. No, of the queers. Of the queers. No, it's not L either. Come on, you're down to it. Someone's got to get to it now. No, not T. Oh my gosh. Thank you. B. I'm like, I need extra time for the presentation. They may never get to this. It's B4. It's about half of the queer population is B, identified. And the weird thing about that, and the reason why I really want to bring that up here, is because we don't hear about B very much, do we? The challenge with that is that B people, like me, get stigma from within the community and from outside the community too. We don't always feel very community identified. That means that if you're looking at our health stats, that they're worse than either the L or the G population. So the fact that you don't hear B is not a good thing. That's a sign of more of the oppression and stigma that happens. So we want to actually make sure that we do include B and we recognize that it's half of the queer population. All right, you guys are doing so amazingly. Well, except for that last thing. Okay, now here's your test. All right, this was just someone's Instagram identifier. How are we doing it? You got this? This is just an Instagram account for LGBT whales. And what I'm talking about is like how well accepted some of these things are. So let's go through. Ready? Ready with me? Jay, one of the people who is a moderator for the Instagram account, is pansexual, asexual, gender fluid. Ave is male to female. Jax is gay and gender fluid. Sarah is bi and pangender. Dylan is asexual. Lexi and Ace are asexual. Connor and Connolly are female to male. Ollie, Sam, and Rimpin, I guess, are gender fluid. Anna, Elena, and Ven are pansexual and demisexual. And Mags, Eric, and blah, 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 are all pansexual. Got that? You're getting there. You're getting there. But it gives you a sense of how these words are really being used, especially by the younger population, but of course, the people who are right now we're the most worried about related to smoking. Remember our takeaways, okay? It's not as confusing as those middle slides. The 3 rules were just focus on using LGBT, LGBTQ, or SGM. If it's uncomfortable, make you just ask and echo it back, or use community experts. That's it. That's not too hard, right? You're still intimidated by the middle ones, but just those 3 rules will get you there, okay? Terminology questions, anything else? All right, on we go. All right, let's talk about smoking. There we go. Okay. Right now, nearly 1 in 3 of us smoke, which is a rate that's over 50% higher than the general population. One of the best places to get smoking data, actually on a federal level, the National Adult Tobacco Survey has been our biggest information related to smoking. And NATS, well, it's not being administered now. It still has 3 waves of administration. And the states can break out their own data. Do you have any specific LGBT data for Arizona right now? Okay. You can get your own data breakout from NATS if you want to figure out a state-by-state ratio. But as I always tell the states, if you don't have statewide data, you really have to ask yourself, because these numbers have now been confirmed by so many surveys, you have to ask yourself why there would be any reason why national data does not apply to you. So basically, if you do not have state-specific data, use the national data, because there's no real theory why it would not apply to you, right? Of the SGM populations, trans and bi people experience additional discrimination, and as a result, the smoking rates are higher. Actually, trans smoking rates have been reported at up to 83%, but I'm happy to say I'm a co-author of the first full probability national data set related to trans smoking that just came out a couple weeks ago. And we did find that it was closer to the 50% higher in the full probability study, but we also found that it was much higher for all of the other nicotine options, except for cigars. So all the alternative nicotine options, e-cigarettes, hookahs, everything like that was also much higher. And then for bisexuals, usually we find the smoking rates higher. In the biggest study so far, we had that bi women are 2.6 times more likely to smoke than straight women. So again, the more stigma you have, the more your smoking rates are going up compared to the general population. And this works with N. So we've got for 9.4% of LGBT adults are active with e-cigarette use, double the rate of non-LGBT. 1/4 of our population had tried e-cigarettes as of 2013, and that's obviously even probably gone up since then. And then we use cigars, cigarillos, pipes, and hookah at 1.5 to 3 times the rate of others. So basically, if there's any way we can get our fix, the chance is we're getting our fix at a much higher rate than the general population. And then if we are members of populations that experience dual stigma and discrimination, like racial and ethnic minorities specifically, then our smoking rates start to reflect that. They're much higher than our racial and ethnic referent groups. Hispanic youth twice as likely to smoke cigarettes, 60% more likely to smoke hookah. Black LGBT youth smoke cigars and club cigarettes 66% more than white LGBT youth. And people living with HIV who are disproportionately LGBT have huge smoking rates. And if people were following what the Centers for Disease Control gave out about 1.5 years ago, they also told us that smoking and HIV interact at a cellular level to have a synergistic effect and have an impact on your health that is worse than either of them separately. So if anybody is HIV positive, if their meds are managed right now, their #1 risk for dying is smoking. So we really have got to kind of pay more attention to how HIV is having a real impact with the smoking population for LGBT and non-LGBT HIV positive people. Okay, passing it on to our youth. Unfortunately, we currently have the LGBT smoking epidemic is right now, we are smoking at the rates that the general population was in 1985. So we've kind of preloaded this whole epidemic to last for that many more decades unless you step in to change the course. So how do you change the course? Oh, I'm sorry, and actually, so I have a separate set of slides that wasn't included in here, but to answer your question, why do we smoke more? So what's the average age of initiation? 12? Yeah, exactly. Okay, so 12, right? When do people usually come out as LGBT? their teenage years, right? Usually when you hit puberty is a time when you figure out that you're either not attracted to the same people your friends are attracted to, or you don't seem to be the same person that your body's mushrooming into, kind of thing, right? So we have that bad problem that we experience the phenomena of coming out and the social isolation that comes with it at the same time that there's a high risk for smoking. And what's the pretty profound difference between LGBT youth and youth from other stigmatized populations? Understanding there's a big overlap. If you were like a black non-LGBT youth and you're an LGBT youth, what's a pretty profound difference in your home life? Right, your parents are usually black, right? Which means that if you're, a black, many times, which means that they've usually done a little bit more on how to navigate safety, how to teach you how to be a little bit safer in the world that we live in, how to move away from some of the most hostile neighborhoods, how to manage people when they are bigoted in your face, all sorts of things like that. But the LGBT youth are not usually born into LGBT families, right? So that means that at a very young age, we experience stigma from our family and from schools in most common scenarios. And if any people work with youth in the room, they've really shown that one of the most profound ways you can stabilize an LGBT youth is just having any adult that's accepting in their life. Because for too many of these youth, they have nobody who's accepting whatsoever. So that's a real way you can change the course of their stability. Okay, so this is the big takeaway. You all remember the side-eye? I think this is the side-eye heard around the world, if I'm correct, pretty recently there. That was obviously at the inauguration. Now, I'm not trying to say that we're like the Obamas and you're the Trump administration. That's not what I mean. No. But if you're going to take anything away from this, I do want you to take away this idea that we have a history of stigma and discrimination. Right now, is it legal to discriminate against LGBT people in a healthcare environment? Yes or no? Yeah, it still is. There are some regulatory protections put in place for some of the healthcare environments. There are some protections that are kind of deeply hidden that like the Joint Commission has, things like that. But there is no law protecting us from health discrimination. And even those regulatory protections, as a matter of fact, literally right now, as I understand, the new presidential administration is releasing today, according to the New York Times, the first rollback of some of those regulations. So that particular one's in the education arena, but we can't imagine that the health arena regulations are far behind. So it's legal to discriminate against us. As a matter of fact, do you have statewide non-discrimination protections for LGBT people? Did somebody know? You don't. Okay, great. So that also means, just to be clear, that it's legal to kick me out of this hotel room. I was actually talking with someone earlier and saying that, as you talked to, you're from Indiana University, when I applied to go there for my doctorate, they turned me down, and I asked them why, and they said, because you're trans. I was pretty amazed that they said it to my face. But I also realized it was perfectly legal. I couldn't do anything about it, except go on to be successful and invite back and then tell them the whole story to the whole university when I was invited back to speak. I think that's a good way to deal with it, too. So if we know that we've got no legal repercussions if you discriminate against us, and we're used to this history, that means that we're coming at you with a major side eye. We just don't yet trust you. So the important thing about this is, if you want to show me that you are a welcoming cessation provider, health educator, anything like that, you're going to have to take some step to show me that you are welcoming, because I can't tell by looking at you. Okay? So how do we do this? And also, just to be clear, even if we haven't experienced discrimination ourselves, oh, trust me, our friends have told us about it. So this ripples around our communities, right? So how do we do these things? First of all, whatever program you have, ask yourself, how does it look from the outside? What I do, and I won't do it right now, right here, but it really, welcoming starts at home. One of the things I often do is I can go up there and I can say, Arizona Department of Health, search lesbian. I don't know why I just picked lesbian. What comes up? Will something come up? It may not come up. And if it doesn't, then that means from the outside, I can't tell that you're welcoming. What about your organization? Does anything come up if I go to your website? Like, our websites are really our storefronts, right? In a lot of cases, right? Or does it come up when I walk to your door? If you've got a physical location, can you see anything that shows that you're welcoming? Does anybody have an example of something that might have out there that's welcoming on their website or in their office? Cool. Excellent. Yeah, exactly. Something out there to show that you're welcoming. That's a great example. Other examples? Yeah. Yeah. We've all heard about North Carolina, right? I remember it was years ago when I was going to a movie with some trans women, and I went up and I got my popcorn and I got my mega drink and everything like that, and both of them didn't get anything. I'm like, you sure? My treat. They're like, oh, no. And then I realized it's because they could not drink a lick because they could not go to the bathroom until after the movie, and they got all the way home. And this was in New York City. So can you imagine what it's like? And can you imagine if you had to arrange your whole life based upon getting back to a private space? So yeah, exactly. So on your bathroom stalls, and New York City had a great response to the North Carolina thing. They just said that every single bathroom stall in the city has to put up as all gender, which is brilliant, right? That's simple, doesn't change any facilities or anything like that. If you have single bathroom, just put up all gender. I was happy to see that the White House had even put up all gender bathrooms. I'm not sure if they're still there. It was, I don't think I'm going to be invited back to check, as a matter of fact, so that's probably fine. But the real question is, how does it look to us? Because your welcome starts in your own agency. Do you have a non-discrimination protection against LGBT people in your agency? If you don't, then that means that we don't necessarily think that it's safe to be there. Now I'm going to do something quickly here. We've got about 150 people? Okay. All right. I don't want to know who's queer in this room. I am going to ask you, if you are open about being queer and have already told people and are fine telling the 150 people that you're queer, please raise your hand now. 1, 2, 3, 4, 5. Okay, not bad. Not bad. We should have about 7. Just to be clear, that's the average. So and it's usually about 1 every 25 people, according to federal surveys. 1 out of every 25 people will tell a total stranger that they're queer on the telephone. And you might ask, well, but it's the work environment. Why does that come into it? Trust me, if you're with someone 8 hours a day, it's much more energy to hide being queer than it is just to say that's part of your life. That's who your partner is, that's where you went over the weekend, you went to Pride, whatever it is, right? So ask yourself in your agency, how many out LGBT people do you know? Because if it's not many, if it's less than 1 out of every 25, then you might not have a welcoming environment. And if it's not welcoming inside, it's going to be really hard for you to be welcoming outside, right? I went to Texas and asked them how many LGBT people they knew in the health department of 5,000. This was their answer. So the sad part is, how successful can we be in being welcoming when they clearly don't seem to be as welcoming inside? Well, Altria is very welcoming for a lot of different groups, as a matter of fact. So here we've got their military network, their LGBT network, their women's network, Latino network. It just goes on, right? So this is where we got to take a lesson from the tobacco industry because they know how to make us feel comfortable. Vermont Department of Health, for Pride last year, made a rainbow version of their logo. It's as simple as that. It's beautiful. 5 minutes. Oh, I'm going to go faster. Watch me go. Okay, what's the best tactic you can do if you want to get expertise on how to be more LGBT welcoming in any of your programming? Take the LGBT people at your own agency and form a professional group where they can advise you on your services. This is National Institutes of Health version of that same thing. The feds are doing this all around to great effect. And then, are you reaching out to us? Pride is one of the great ways, 3rd weekend of June, usually, although in hot places it's different. When is it here? April. Okay, sorry. Yeah, desert's different. And also, it's usually April on campuses too. Reaching out at Pride is a great way, and more tobacco companies, tobacco control organizations around the country, including New Mexico, does a great job, have a really aggressive level of outreach at Pride. And let's just be clear, you don't need to have an LGBT person in your agency to outreach at Pride. Because like the North Carolina Quit Line ladies are such a fixture. They get a car, they decorate it every year, and if they don't show up at Pride, people are sad the Quit Line ladies aren't there. So it doesn't mean you have to be queer just to go there and enjoy the fun. When you do, you're showing not just the people in the urban area, but if you're in a rural area, trust me, they're coming in from the rural areas to get to Pride. You're showing them too that the Quit Line or your services are welcoming. Okay, So once they get in the door, what are the next steps to make sure you're really doing a good job of serving the LGBT population? First of all, make sure you're collecting data on us. On your intake form, if there's nothing asking if people are SGM, then that's another way that you're not showing us that you're welcoming. And the Quit line has recently adopted a great, I should say a great, I don't know, I helped test it, so it's bad to say great. National Jewish helped us test this new way to ask the data that's kind of as simple as possible. The first one is pretty easy. It's just, do you identify, across your lifetime, do you consider yourself to be LGBT? That's easy enough to at least add on the shortest of questionnaires. And then just remember kind of the basics of how to be an ally. This one's around how to be a trans ally, but this is the important stuff. Know your terminology basics. Reinforce the person's current gender presentation. So if Wayne tells me they actually want to be called Mary, here's a great trick for doing that. Oh, Mary, thank you very much for telling me that. So Mary, I'm going to have to probably write something on the side because, as you can understand, Mary, this is attached to your health records, and so we don't have an official, but I'll put something in to make sure everybody else remembers to call you Mary too. Think, how many times did I say Mary in that conversation? More than I had to. And it's one of the tricks we use, because every single time you respect someone's requested gender identity, requested name, anything like that, is another time you're showing them, I welcome who you are. Because trust me, I've had the conversations where, like someone says, oh, I want to be called Mary, and it's like, oh, you get really awkward, right? And you can tell really fast, or they try and talk to someone else, they won't use a pronoun. It gets you, it's like Chinese, and it's crazy. Don't do it. I was going to say Chinese origami. It doesn't make sense, but origami was what I meant to say, which probably is sometimes Chinese. But you twist yourself into a ball. So just the basics, reinforce the way they present now, reinforce the fact that you are going to treat them with respect, not like everybody else, because you have to put out a flag of welcome. That's what you have to do differently. But you're going to treat them with respect, which also means that sometimes in cessation, one issue you've got to deal with is what kind of stigma are we getting for being LGBT? Because if you're not dealing with that elephant in the room, we're not going to be able to get down the Maslow's hierarchy pyramid to the things that also affect us, like smoking. Just as another note, respected identity documents are a real barrier. 68% of trans people have no identity documents that are updated. So that means 68% of the people walking into you may show Mary on their license, but want to be called Henry. And you've got to find a way in your documents to make sure Henry goes in the side, right? So you keep calling them Henry. And then just think in the process. If you're running cessation groups, and the cessation groups are mixed, SGM and non-SGM, do we feel comfortable bringing up SGM issues in the group? If we don't, again, it's an elephant in the room. Our cessation is not going to be addressed until we are able to talk openly about the factor that really affects our smoking rates. So just think about, how are there ways that you can make the welcome in any kind of environment that we're in? And sometimes that just means modeling yourself the welcoming so that other people can also. Like, so what about your girlfriend? Tell me, does she smoke? Things like that. You can just continue to make sure you set the tone for whatever engagement you're in so that people feel comfortable. And here's actually also a trick I do when I'm actually just doing the cessation quit line trainings, is if someone's avoiding talking about a partner and you suspect maybe they're LGBT, really easy verbal trick can help show that you're welcoming. Well, your partner, he or she, I don't know what they are, I don't know if they smoke or not, but that makes a big difference. And you saw what I did there that fast. I just showed them that it didn't matter if they were partnered with a boy or girl, either one was great with me. And I think, spread available resources. You know, the federal government is investing over $30 million in this LGBT youth smoking campaign. They're cranking out stuff on a regular basis. You can find them on all the social media channels. Use their stuff because it's cheaper than making your own. And then again, if there's anything, questions on how to do this yourself, get your in-house experts who are LGBT people or SGM people in your agency to professionally advise you on this. That's the smartest way to start. And with that, I think I'm probably at time. Thank you. Oh, questions, sorry. Well, look, I still have time for questions. All right, hands up, everybody, at once. Somebody, yes. Oh, I'm sorry, I only have this one.
No, I'll talk loud, I can do that.
Yeah, you can do that.
So you talked about group of them being mixed. What about the telephone quit line activities? And can you address the challenges?
Yeah, I do a full training just on quit line counselors alone. And honestly, the main precepts of that are exactly the same thing you see here. You have to show that you're welcoming first. If not, they will never feel comfortable coming out. Once they do come out, you've got to use those skills. Like if you stumble over like, this person wants to be called she, and my mind says he every time they talk, then just apologize quickly, move on, and I'm sorry, I meant she. And just keep using those welcoming tactics. Because all the people who do cessation are trained, the exact specific phenomena in our life are not going to be different. We just need to be able to talk about how LGBT interacts with it. And another hint is, we usually will have no clue it's related to our smoking. So if you're doing cessation, you're usually going to have to tell us that it's something related to our smoking and kind of open our minds a little bit related to that. I know you're frowning at me. We usually don't know that we have disparity. Yeah, we have no idea. We're like, what? We smoke more than others? We have no idea. So we haven't been thinking about how LGBT relates to the fact that we smoke more. We haven't made the connection between stress and stigma and tobacco use. Yeah. No?
Okay.
Great.
I just like the mic. So you used a word that I liked, and that's requested. And on our forms, our referral forms, first of all, we use the NAC recommended pilot gender and sexual identity. But on our referral forms, we have those categories, and then the legal name that's usually going to come out of the health record or whatever, and then preferred name. And I know there's been some discussion around the use of the term preferred because it suggests that your preferred gender is not your actual gender that you identify with, whatever. But I wonder, putting requested on there, is that something that people at this point in time are going to understand what you're getting at?
Yeah, your bigger issue of people you might confuse would be non-LGBT people who are like, what do you mean? I just gave you my name a second ago. So, but usually in a form situation like that, it's pretty straightforward, and since it's one-on-one, they can usually ask someone, or you're interviewing them, and you can just explain it if there's any kind of confusion. So the LGBT population or SGM population will usually understand that very well. No, not at all, not at all. We don't have a replacement for it yet, so don't worry. It's one of those language things that's still working. Yeah.
Okay, this isn't about tobacco, but it's kind of personal, and I don't know if I can get it out and ask it. But
here with you.
With bisexual, when does it become a trend or a real thing? And then why would you need to know that? And why I'm asking is because I have nieces that live in New York City and go to school there, and to me, when they talk to me and tell me things, it's like an at-risk behavior of being with the group that they hang out with.
So it's a great question, and the easy way to answer that is that especially with all youth, it always works better if we respect what they're telling us then as being really valid and true for them. And don't throw any shade that maybe it's not going to be true forever, right? Because a lot of LGBT people have had that. We've had the whole, oh, it's a phase, you'll get out of it, you know what I mean, kind of thing. So instead, the better thing to do would actually be, like, if they're identifying as bi, hook them up to the positive bisexual role models. There's a million of them on Facebook. There's the Bisexual Resource Center that's based out of Boston. There's BiNet USA that's based out of California that are both national groups. So the better thing is to affirm what they're saying and hook them up with positive resources that aren't just social influences. If they change their minds later, no harm, no foul. And if they don't, you are. Make sense? You know, I'm going to say one more thing to what you were saying too. One thing that is going to be slightly different with cessation with the SGM population is the sociologists kind of say that we have 5 domains of social support: home, neighborhood, work, family, friends. With the LGBT population, we may be lacking social support in many more of those domains than the average person, which comes into play with cessation because, for example, like I actually think it was in Arizona when I first met the guy who's like, I can't stop going to the bars. I want to quit smoking, but I can't stop going to the bars. Because the friends were the only place he got any social support. So he had to go there for his own health, but that was also where the smoking was. So him and his quit line counselor had to be creative about how to respect the fact you can't change all those habits if it's the only place you're getting support, but still get to the end goal of getting rid of the cigarettes, right? Does that make sense? All right, other questions? See Dave standing up there, so that might be a hand. Oh, you're just handing the mic around. There are 3 breakouts, so you will get to talk to me endlessly, so please feel free to do that. We will go into 102, 103, everything you need. All right, you guys have been great.